I'm Tom Myers. Welcome to Anatomy Trains. Anatomy Trains is a revolutionary new understanding of how the muscles connect through the fascial fabric of the body. In a way, it's similar to kinetic chains you might have heard about. It's also similar to the meridians in acupuncture. But Anatomy Trains is based wholly on Western anatomical understanding. It's a new, clear map of the direct force transmission through the fascial fabric of the body. Fascia is what used to be called sinews, the sheets and strings of connective tissue, the white gristly stuff that holds us together. It's the stuff that envelops the muscles and attaches them down onto the bones. And although the fascia permeates the whole body with a network through the organs, the brain, the lungs, and everywhere else, this Anatomy Trains map focuses on the direction of this fabric through the muscles. Force is transmitted from muscle to muscle via this fabric, and that creates the postural and movement limitations we see in our practice every day. The whole connective tissue matrix is one single net. All the divisions that you find in the books, and even the Anatomy Trains themselves that you're about to see here, they're all made with a knife from this single, indivisible whole net. Please remember that as we start looking at all these parts. The whole is real. Any division is conceptual. The fascia has a grain, just like fabric or wood, and we'll be tracing the grain of the fascia, which makes sense out of this bag of muscle tissue that we all live with. Muscle without fascia is just a hamburger. Muscle in our fascial net makes sensible movements. Unless, of course, it's too short, or too stuck, or too weak. Here's the news. Books tell us that the muscles just attach to bone, but the muscles also connect to other muscles through the fascia. Look, the rhomboids are being pulled under the scapula by the serratus anterior, as they do when you put somebody's arm behind their back. And this happens all over the body, as you'll see. It's this muscles attached to muscles idea that really leads to the new treatment strategies you'll learn in Anatomy Trains. Dissecting out these Anatomy Trains involves one simple change in approach. We turn the scalpel sideways. Instead of cutting out each muscle, we come to the attachment, we slide the scalpel sideways under the attachment and maintain the fascial connection from one muscle to the other. They've been there forever. It just took until the 21st century for us to see how muscles work as a system, the myofascial meridians. So, maintain a consistent fiber direction and maintain the fascia connection between the muscles, and voila, we have an Anatomy Train. You're about to benefit from seeing the connected, meaningful, functional units that surround and position the skeleton in the continual dance of life.